evening. Welcome to the Buncombe County Board of Education regular meeting. This is Thursday, February 4th, 2021. I want to call this meeting to order and acknowledge that we have two board members that are joining us virtually, Peggy Buchanan and Max Queen. At this time, I would entertain a motion to approve the agenda.
So moved, Madam Chair.
Thank you. Could I get a second?
Second.
Roll call. Pat Bryant,
Aye.
Amy Churchill,
Aye.
Amanda Simpkins,
Aye.
Max Queen. He's joining us by listening. Cindy McMahon,
Aye.
Peggy Buchanan,
Aye.
Ann Franklin, yes. This meeting is now in session. Tonight we have a virtual presentation of colors and the Pledge of Allegiance by the Inca High School's Air Force JROTC under the instruction of Major Kevin Dean Bauer, USAF, retired, and Master Sergeant Douglas Draper, USAF, retired. The presentation includes the national anthem performed by members of the Inca High School Wind Ensemble, directed by Kevin Young. I ask that we all rise.
Color guard, attention. Carry colors. Forward, march. Color guard, halt. Present, colors. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Order, colors. March.
Standing, and that we focus our thoughts tonight again on our country as we move through some very strange times. Thank you. You may be seated. At this time, we will recognize people for public comment.
Yes, Madam Chair, I have confirmed we do have 22 public comment sign-ups for tonight, and we do have our first entering now. Sir, if you could start with your name and where you're from, as well as, I'll give you 1 minute, and as well as a 10-second warning, all right? You'll have 3 minutes. Thank you.
Thank you. My name is Tate McQueen. I'm an educator here in Buncombe County. I've spoken before to the board members. Thank you for the work that you do. Thank you for the decisions that you've previously made. Undoubtedly, you've likely saved lives, and I'm indebted, as well as my peers in the school system. Tonight I brought my son, Lachlan McQueen, and I just wanted to start by saying that Lachlan and my daughter are both honor students. That hasn't changed because we've been remote learning. That hasn't changed because the teachers they have in the building and the jobs that they're doing at Irwin Middle and at AC Reynolds High School is stellar. And yes, it is a challenge. And challenges prevent opportunities to prove who we are and what we're made of. I grew up at Wrightsville Beach. I distinctly remember riptide flags, and every now and then someone dying from being caught in a riptide. They put the flags up as a warning so that others wouldn't go into the water after the riptides had been noticed. We've had a lull in the hospitalization rate, that is true. And every time we've reopened in some capacity, we've had an exacerbation of that hospitalization rate. We're on the edge of seeing this through. I heard talk of getting a second vaccination in here. I'm waiting for my first. My colleagues are waiting for their first. It only seems right to see this through properly. My son is a remote learner out of concern for his peers and his teachers. My daughter stays home out of concern for her peers and her teachers. And as Dr. Baldwin said, it will be very difficult to open the buildings in a return to learn if the teachers are impacted. And I'll just close with this. We still have people who aren't taking it seriously, and they're in our buildings. And we still have teachers who are taking it seriously, like a former Buncombe County teacher, Roger Teeple, who retired and is now teaching in Georgia, who was very fortunate to come out of the hospital recently. It's not a joke, and we need it to be treated as seriously as it is. This is our time in our history, just as it was in 1917. And we can do this if we show the resolve. And I hope that you'll read the email that I sent you that is a little bit more detailed in my desperate pleas that we remain as we are until the teachers and staff can be vaccinated. If we're going to be on the front lines, if we're going to be considered essential, if we're going to be considered heroes, please treat us that way. I think we've earned it. And with your support, we can get through this. But I brought proof that it does work and we can do this because my son's grades have not dropped, nor has his sister's. So I thank you for your time and your consideration, and I'm begging you, please, let's do this the right way. Thank you for your time.
Thank you, sir. I would like to call our next public comment after they exit. All right, we're ready for our next public comment. Thank you. Hi. Please start with your name and where you're from. I'll motion at 1 minute, 10 seconds, and you'll have 3 minutes. All right?
Okay.
Thank you. Please begin when you're ready.
My name's Loretta Ball, and I am North Buncombe District, and my children go to North Buncombe Elementary and North Buncombe Middle School. Thank you for your time and letting me speak, and I am not a public speaker. I'm just a mom that is concerned for her children, and I am here to speak on behalf of other parents that are struggling with virtual learning. So I wanted to start off and say virtual is not working for our family and my children, but it is working for other families, and if there's any way we could keep virtual for the ones that it's working for, but then let the schools open back up for the children that need it, and the parents that need it also. I have reached out to several of my other parents and friends that have children at home and have heard their concerns of how virtual is not working for them, and I'm just going to go through a few little points of what I've heard from them. Before, I would like to start with my personal story with my children. My 7th grader is he loves school. He loves everything about school, and virtual has it's really shut him down. He's failing. He is, well, I would say he's getting depression, his self-worth, because he's fallen so behind on his schoolwork. And as a parent, I get frustrated and I will raise my voice and probably yell too much. That's just daily for us now, and it's heartbreaking as a mom to have to do this. My 4th grader, it's like trying to get a feral cat to sit in front of a computer screen and learn. He is all over the place, and it's a lot of tears and a lot of frustration for us. So that's in our household. And so just other things that I'm hearing about is the mental health for our students, the stressfulness of parents, working parents. I'm at home now, but my job is seasonal, so here in a few weeks, I won't be able to be there with my children to help them as much as they need, and stuff I can't help with. They need to be in school, and we have such great teachers. I would like for them to be in there. Kids with special needs that are at home and their parents they don't know how to teach their children. The special needs children need those teachers that are qualified. And we've also got stressful situations. It's just stressful. So anyway, I want virtual to last for those that it's working for.
Thank you. Thank you for coming. I'd like to call our next public comment, please. Welcome. Please start with your name and where you're from, and I'll give you a motion at 1 minute and 10 seconds, and you'll have 3 minutes. All right, please begin when you're ready.
Good evening, board members. My name is Jonathan Brown. I'm a lifelong resident of Buncombe County. I received my education from the same system that I'm here today to fight for my children and for so many others. The research is starting to surface about the detrimental effects of virtual and remote learning on our children. We have to get back to the classroom. It's critical for our future generations. You are sitting here tonight because you were elected and are paid to represent the community you serve. Myself, as well as many of us, others of us here tonight, feel as though we have lost that representation. We are given 3 minutes with no interaction other than the constant attentiveness to the time we have remaining before sharply being asked to leave, as well as the hundreds of unanswered emails that we've sent. I sat after speaking at the last meeting and listened to your concerns. Local metrics still seem to be of interest, but I remind you again that less than 1% of total cases in our state have come from the K-12 school setting, and this includes teachers. You also talked about how you have provided extra virtual resources for our children with special educational needs. Having a son with autism, this was a slap in the face. Most children with special needs cannot function on a device, so these extra virtual resources essentially do nothing. Staffing seemed to be another concern. After doing some research, I'm appalled to learn that Buncombe County has over 500 currently active substitute teachers. The governor, the CDC, as well as our president now recommend that our students return to the classroom with the implementation of protocols, yet we are not. Why? Why have several private schools and child care facilities like the one I'm employed with been able to operate without incident since March of 2020, and our public school system cannot? Why is every county in Western North Carolina able to have in-person learning except Buncombe? You were handed a petition tonight signed by those of us that you represent, pleading with you to allow our kids back to full class instruction. Through the journey of trying to collect those signatures, there have been many stories, including teachers, that are scared to death of saying anything in fear of being terminated if they were to be found in favor of returning to class. We're in a really sad place if we've sank that deep. I'm aware that we have many immunocompromised families that have chosen remote learning. For them, that works well, and it should continue to work well. Unfortunately, for a large majority of us, that's not an option. We need our kids in school to be able to provide their basic needs. We deserve a choice too. We have learned a lot in a year. Trust in what we have learned and in those achievements as we decide on how we push forward with the Return to Learn plan that's on tonight's agenda. I thank you all for your time.
Thank you, Mr. Brown.
Thank you, sir. I would call our next public comment, please. Welcome. Sir, please start with your name and where you're from, and I'll motion for you at 1 minute and 10 seconds.
I am Nathaniel Brown. I am from Asheville. The longer you keep kids out of school, the dumber they are becoming. You don't know what background or family dynamics each child comes from. There are kids with abusive families or single-parent families, and school is their only safe place or a place to stay warm and get food. So ultimately, either the kids go to work with a parent, but only if their jobs allow, or they stay home and do virtual with no supervision or no parent to make food for them. In addition, that doesn't even involve the special needs kids like me. I have ASD and ADHD combined. I was supposed to return to Buncombe County Schools at the beginning of the year, but y'all are keep choosing virtual and can't return to and won't let us return to Buncombe County Schools. I am being accepted at Ladinga until you allow us to go back to schools because I can't do virtual. I can't function or understand at my fullest potential on a computer. I need instruction in a classroom Paperwork with little to no explanation does not work for me. It's not fair for you to ask my parents to try and be my classroom teacher, even though y'all are the ones getting paid to teach us. So please allow us to go back to school. We students can't learn this way. Thank you for your time.
Thank you.
Thank you. I'll call our next public comment, please.
We have another little one.
Okay.
Do you want to stand right there? There you go. Can you hold that?
Welcome. Hi, could you start by telling us your name and where you're from?
I am from Asheville, and my name is McKenzie. You keeping kids out of school is making us more lonely, in turn making us depressed. I, of all people, should know because y'all are keeping us virtual. We don't have friends to play with, and that makes us very sad. Our relationships we did have no longer exist with each other due to virtual classes. Teachers I know really want us in school, but they don't want to lose their job for taking a stand against you all. In addition, our health is at risk. Our eyes are damaged by the blue light in the computers. Our kids miss school that we had fun in, and most of all, we miss our teachers. Please let us back in school. Thank you for your time.
Thank you.
Thank you.
That's her mom.
All right, I would call our next public comment. Good evening. Hi, please start with your name, where you're from, and you'll have 3 minutes.
Hi, I'm Brittany Brown. I'm from Asheville. I come to you tonight to plead that we allow our children to go back to school. Every other county in North Carolina has allowed school to open, and we are the only county, yet their COVID rates are a lot higher than ours. And I work in healthcare, so yes, we are primary ones that are getting the vaccine, and teachers are at far low on the list because children are less likely to get COVID than us healthcare workers. That is why the priority is on the healthcare workers and not on you teachers, because the risk is very limited to y'all. Virtual school is not doing our kids any favors at all. I have 2 children who just speak that I'm very proud that they came to voice their opinions, but like both of them have said, special needs kids are falling behind. My son can't even return back to Buncombe County schools because y'all don't have adequate teaching for him, adequate learning abilities for him to learn. My daughter is gifted. She has a very high IQ, and y'all are failing her left and right. She is done with her schoolwork within 30 minutes of getting on the computer at 8 o'clock in the morning, and that is not acceptable. We are paying you guys to teach our kids. We pay our tax dollars to ensure that y'all can teach our kids appropriately and to provide public education to our kids that is free. It is not fair for you to ask us parents who do work jobs, who do try to provide for our kids, to teach these kids that we pay y'all to do. It is COVID time. Yes, it is a pandemic time. Yes, understand. We all learn, we all develop, and we all grow from it. It is not unusual. We had a pandemic, it's called TB. We also had another pandemic, it was called the flu. We have learned, we have developed, and we have grown. Not one time during that time was school shut down. Not one during that time was school ever a cause for concern, because a school is supposed to be a safe haven for children. Children in dynamics that you don't know, maybe abused, maybe coming from families that you have no clue about because you don't know them like the community does. And their only safe place to be is at school. Their only safe haven is the teachers. Their only warm meal is school. And some of them can't even go get that because their moms are at work and they're left at home to do virtual. And half of the school, the children can't even get internet because they can't afford it. And yes, Charter was offering a deal, but that deal is lame because we tried it and it didn't work, and we ended up having to pay over $60 for it. And that's not fair to us. When y'all are supposed to be providing for our children, y'all are failing them rapidly. The BOGs show that children are 1 to 2 grade levels behind where they should have been last year. Now you expect our kids to come and take the EOGs, and guess what? They're gonna fail at a rapid rate. You are completely failing our children, completely. I ask that you please put them back in school.
Thank you.
Thank you. One moment while we clean the microphone.
And if you want to stand right to the side there, okay, you can hold that.
Hi, welcome. If you could start by stepping a little this way. This way. There you go. So you can see you on the camera. Please start with your name and where you're from, and you'll have 3 minutes, and I'll hold my finger up when you have 1 minute, okay? All right, thank you.
My name is Naxasito, and I need to go back to school. I am a second grader at Black Mountain Primary School. I need to go back because I am getting very frustrated, crying, and having meltdowns. This has never happened when I was at school. I have a lot of screen time, and it's bad for my vision and brain. I am starting to forget how to do things correctly, like spelling and writing neatly. I need to have my friends around me. My teacher helps me understand schoolwork, so please let me go back to school. Please.
Thank you.
Thank you for coming. We are ready for our next public comment. Hi, if you could start with your name and where you're from, and I'll motion for 1 minute and 10 seconds, okay? You have 3 minutes. Please begin when you're ready.
Yeah. So my name is Tiffany Aceto, and I'm representing the Owen District. I was here in December and spoke. That was my second grade son that you just saw spoke. He worked very hard and begged me to come here to speak tonight. And what breaks my heart is the frustration that not only me and other students and parents are having right now is a question to you board members. How can you listen to that and not let our children go back to school, yet y'all are letting sports go on? Like, how is that acceptable? It's mind-blowing to me. And I'm just very frustrated. I came here, and when I spoke in December, I said when we were all virtual from August until mid-September, my 8th grader had 14 Zooms canceled by teachers. The same thing is happening again now. From January till now, she has anywhere from 1 to 3+ Zooms canceled on the days that she's supposed to have Zoom. Reasons? Teacher meetings. Why are those not done on Wednesdays then, whenever you're supposed to be asynchronous? I'm working from home and my internet's not working today. These kids are trying to show up and learn. Just on Tuesday afternoon, I had the half day off, and I heard my daughter's ELA teacher tell her whole 8th grade class that if they are summoned now to tutoring on Wednesday, that the county had a meeting last week and said so many kids are failing that they're having to do tutoring on Wednesdays, and if they're not showing up for tutoring, they may not pass. She broke down in tears, anxiety, because she's worried because she's failing a class right now that she had an A and a C in the first semester. And now she is struggling, and she's afraid now that she's not going to be able to go to high school. My second grader there, he has never had emotional issues before. And I am seeing a totally different side of both my kids. My 8th grader would not come to talk tonight, but I asked her, how has virtual learning been from you? Her words are, I am isolated, I am sad, I am unhappy all the time now. And we are all going through that. I'm a nurse, and I've worked every day during this pandemic. I get our emotional needs, but these kids are struggling, and y'all have got to realize, and if y'all aren't looking at the grades across the county, then you need to look, because the Owen Middle School principal at the beginning of January sent out a message saying that they were bumping all second semester 9-week grades that's below a 50 up to a 50, just like they did the first 9 weeks. So evidently there's a lot of kids out there that are failing, and I feel like y'all really need to look at these grades and ask these kids. These kids are struggling, and us as parents that are working and leaving our kids at home because we have no choice, it's a dangerous situation all the way around.
Thank you.
Thank you. I'd call our next public comment, please. Cleaning the microphone.
You can just stand right there.
Welcome. Hi. If you could start with your name and where you're from, and you'll have 3 minutes. I'll give you a 1-minute motion. Okay.
My name is Sarah Disher Ratliff. I am a Buncombe County native and proud AC Reynolds second-generation graduate. I am also the mother of 4 boys, 3 of which are currently in school at Fairview and Cane Creek. My youngest is slated to start kindergarten in the fall. And I want to start off by saying the fact that I was personally affected by COVID in October when I lost my father to the virus. So this is not a subject that I take lightly by any means. However, watching my children struggle on a day-to-day basis with virtual learning has become a complete nightmare. Both my husband and I have been lucky enough to have maintained our full-time out-of-the-home jobs since all of this started, therefore leaving my children as latchkey in our home. My youngest was lucky enough to have been in a daycare center that did not close, and we've been able to keep him in school full-time throughout the entire 2020 year. However, I have two children who are considered special needs, one with a 504 and one with an IEP. And even with continuous communication with teachers, all of my children, including the one who is not special needs, are currently failing. In fact, one of my children currently has an average of 23 in ELA. When I reach out to the coordinators at the schools, I get the same answers every time. They understand and they wish the kids were back in classrooms, but there's not much else they can do as they are unable to implement accommodations in a virtual environment. Prior to this, all of my children had perfect attendance and were passing. Now, I have numerous absences and failing grades for all three of my kids. Our family dynamic has changed significantly given the strain of not having our kids out of the house. They barely leave their rooms and they are completely shutting down. Please, please allow parents who need their kids in school back in school. Please. It is absolutely killing our family dynamics. These kids can't learn virtually, and they are shutting down to such a point. You've allowed the option for people who want to stay virtual to stay virtual. Give us that same choice, please. I don't even want to think about the emotional strain it is going to put on my family in order for my kid to start kindergarten virtually. And I have the option to send him to daycare. That's $200 a week, on top of every other expense that has gone up since all of this has started, from power bills to food cost that you're not taking into consideration. I absolutely beg you to get our kids back in a classroom. Thank you.
Thank you.
Thank you. I would call our next public comment, please. Hello, please start with your name and where you're from. You'll have 3 minutes, and I'll give you that 1 minute warning, okay?
Okay. I'm Kayla Stanley. I'm from Fairview. I have two children in elementary school, in third and in kindergarten, and I also have a PEP student in high school PEP. And a lot of areas have been touched on tonight, but just a few things that are affecting my family personally. My daughter is an AG student. I had her parent-teacher conference today, and she's making an F. She is failing third grade. She's never made below a B in her life. My kindergartner, he doesn't know the difference in school, but he is not where he should be. I have to take the time out of my day to sit and explain everything to him because he's kindergarten, he can't read yet. But yet when I need to go run to the grocery store and get groceries for my family, if he misses a Zoom, he's going to be counted absent. Also, my PEP student, you stated before that you guys are going to be giving resources for, some therapies and stuff. He gets none. He does not have physical therapy. He's not getting his speech therapy. And even if they offered it, he wouldn't do it. He would throw that computer at somebody. He needs to be back in school. All these kids do. My daughter, after finding out her grade today, started crying, saying she hates her life. No third grader should feel that way. Period. End of story. My kindergartner, while I have the educational background to be a kindergarten teacher, they don't sit and learn from mom like they do a teacher. I have a child going to kindergarten next year, and I pray to God you put these kids back in school, because if you don't, we're going to have to move counties just so my kids can get the education that they need. But most importantly, my biggest point is going to be for my PEP student. He really, really needs these therapies. It's to the point where he's already wheelchair bound and his knees are already locked up from not getting physical therapy, that I'm afraid he's going to have surgery in the future. And that's nobody's fault but the fact that he can't get therapies that he needs. And I won't go into much more because there's a lot of people waiting and there's a lot of subjects to be touched, but I just wanted to make that voice heard for our children. Please get them back in school. Thank you guys for your time.
Thank you.
Thank you. We're ready for our next public comment, please. Welcome. Please start with your name and where you're from, and you'll have 3 minutes. I'll give you a 1-minute warning, okay?
Okay,
Please start.
My name is Samantha Dobbs. My kids go to Fairview. I played ball for some of y'all out there. I went to school with some of your kids out there. I have a first grader in Fairview. She doesn't get to attend 2 of her Zoom meetings because my 4-year-old goes to preschool. She can't be at preschool till 8 o'clock. She gets out at noon. That's when 2 of her Zooms are, so she's missing most of her education. I work with a bunch of people whose grandparents are watching their kids, and the grandparents are not able to help these kids with their homework, so we're coming home at 5 o'clock in the evening, making dinner, doing homework. Don't know if our kids have been on Zoom all day. It's really frustrating that these kids can go back to school. If I can work in a doctor's office all day, see tons of patients all day, be in their face all day, not get sick at all, not had any outbreaks in our office, these kids can go to school with masks. These teachers can go to school with masks. It works. There's data out there. These kids should be in school. CDC has come out and said these kids should be in school. The governor has come out and said it. It should just be done. No questions, no debates. These kids need to be back in school. And y'all need to do that for these kids. Y'all need to do it. Figure it out. If you can't figure it out, step down. I will figure it out. That's all I have to say.
Thank you.
We're ready for our next comment, please. Hi, welcome. Please start with your name and where you're from. You'll have 3 minutes. I'll give you a 1-minute warning.
My name is Leslie Cannon. I'm from the Inca District. As we close in on a year of virtual learning for our students, I'm pleading with you to send these kids back to school so they can have some semblance of normalcy. My son, a senior this year, has told me how much he misses high school. He wishes he knew that March 13th would have been his last day of normal school. He said, you know, there is no class of 2021. And that's sad but true, because they have not spent one day together as a senior class in school. My daughter is 8th grade, normally a straight A student, and she's failing more than one class right now. And she's done, she's over it, and I'm at the same point. I can no longer beg her to spend more time on the computer to finish assignments. She's on Zooms from 8 to 3, classwork to do after that, and that's too much time sitting in front of a computer. I look at some of her assignments, and they're just busy work more than anything else. They don't need busy work. They need face-to-face instruction. We all know that Governor Cooper and the State Health Department says it's safe to send our kids back, and that it's time to send them back. In fact, the CDC never recommended schools close in the first place. So at this point, it's not unreasonable to ask that our kids be in school 5 days a week. Other states are doing this and have been since the fall. I have a niece and nephew in Anderson County, South Carolina. They've been in school 5 days a week since before Christmas. In comparison, Anderson has 9 more public schools and almost 7,000 more students than Buncombe. They've also had over 1,000 more cases and over 100 more deaths due to COVID, but their kids are in school 5 days a week with no issues. I know we have some teachers that are hesitant to come back into the classrooms. However, the majority of the population at this point is working every day and taking risks associated with their jobs. I'm sure we have parents that would love their kids to be in school so they could go back to work themselves. Teachers have been the only profession that have complained about having to work during this pandemic. And don't get me wrong, I support teachers' safety, and I believe the CDC when they say that schools are the safest environments. Teachers are shopping and dining out, getting their hair done, they can be in the classroom. I know teachers want the vaccine, and I urge BCS to work with the health department to make that happen so the teachers that want it can get it. I know you're tired of having to hash out reentry plans, and believe me, I'm tired of emailing you and coming to board meetings. But I'm not going to give up till these students are in school 5 days a week. It's not been an easy 11 months for any of us, but our children have suffered the most, and you can put a stop to their suffering now. Let these kids go back to school 5 days a week and experience normal school days, and let our seniors come together for the last few months and be the class of 2021.
Thank you.
Thank you. We're ready for our next comment, please. Welcome. Please start with your name and where you're from. You'll have 3 minutes, and I'll give you a 1-minute warning.
Good evening, Dr. Baldwin and members of the board. My name is Josie Frazier, and I'm a junior at Inca High School. I'm here to ask you to consider allowing us to return to school. Anyone who knows me knows that I am proud to be a Jet. I am a hardworking student who strives for excellence. My dream is to go to school, followed by med school, and become a trauma surgeon. For this dream, I need to have the best high school education possible. Because I strive to go into the healthcare field, I need to have hands-on experience in my health science courses throughout high school. I appreciate the fact that Buncombe County now has a virtual option for students who decide that they prefer that mode of learning, but it does not work for all students, and we should have the option to do what we and our parents believe to be in our best interest. Neighboring counties are able to figure it out, and I believe that if you really want to, you can also. I feel that the workload is so much more than ever before. Maybe it is because the teachers think that they need to fill the next hour to make up for the 90 minutes that we would have had in class. However, then the next Zoom starts and all that work gets pushed to the end of the day and then compounded with other work. For many students, it's just too much. Some of us have jobs or have sports workouts to attend after 3 p.m. and are feeling very overwhelmed. Never would I choose this mode of learning for myself, but I understand that we all learn in different ways. But again, I do appreciate the fact that virtual is and will continue to be a choice for those who want it. I'm on the varsity cheer team at Inca High School, so for the past few months, I've been able to enjoy watching sports and seeing my fellow classmates. While I have this opportunity, I'm able to realize that people who are not involved in sports do not have the same advantage. Without being able to see friends and have a safe space, many students are struggling mentally and suicide rates have continued to increase. I feel that schools are a place where people are free to be themselves and have good human relationships. It appears that the board thinks that high school students are mature enough to stay home alone every day, manage our own schedules and workloads, feed ourselves, and even take care of our siblings, but yet we are not mature enough to give our opinion. Members of the board, I beg you, ask our opinions instead of just making decisions for us, and please allow us to return face to face. Thank you.
Thank you. Moment while we clean the microphone. We are ready for our next public comment.
Can you hold that? And just stand right there.
Yeah, welcome. Come on up just a little bit right there. Please start with your name and where you're from, and you'll have 3 minutes, okay? Please begin.
Jaden, and I'm from Black Mountain. And I think kids should go back to school because it's very hard doing virtual learning. And in person's better.
That's it. Well, thank you.
Thank you. You can hand it to your mom.
Okay, we're ready for our next public comment, please. Again, please start with your name, where you're from.
Yes, my name is Ashley Reynolds, and I'm from the Owen District, and that was my son that was just speaking. I want to make this comment short and sweet. I believe that in-person instruction is very important to children and families, especially families with special needs. Doing schoolwork behind a screen is not very beneficial, and it's very stressful to everyone involved. I come home every day doing everything I can to help support my son in his schoolwork. And it gets very stressful. And to me, education is essential, and I do believe BCS needs to open the schools safely for everyone 5 days a week. Thank you for your time.
Thank you.
Thank you. You could put them, clean the mic. Okay. All right, please start with your name and where you're from.
My name is Holden Short, and that was my wife, Ashley, speaking, and we're from Black Mountain. Virtual learning has been a struggle for us. Trying to do everything we can to provide for Jaden and make sure that he has all of the academic needs that he has met has been a struggle. Doing a 9-to-5 job and then having to come home and be a teacher is not for us. We asked the Buncombe County School Board and the teachers to help us and do their jobs and to get these kids back in a safe learning environment so they can thrive the way that we had the same opportunity when we were his age. And asking our parents and our friends who have to stay with these kids while we're at work, it's putting stress on another generation that doesn't deserve this stress. They have their own stuff to worry about. So take it in consideration and please let these kids go back to school. Thank you for your time.
Thank you.
Thank you. We are ready for our next public comment, please. Please start with your name and where you're from. You'll have 3 minutes, and I'll give you a 1-minute motion.
Okay. My name is Dawn Conard, and I'm from the Inca District. I have spoken to the board before on my behalf, but I'm here tonight to speak on someone else's behalf who couldn't be here. Her name is Donda Bennett, and she has a freshman at Inca High School. And she is actually a graduate of Inca High School and UNCA, and she's the regional practice director for Blue Ridge Health. So she's out on the front lines doing the vaccines so that everybody can return to normal. And this is what she says. I work in healthcare, and I have to go to work every day to earn my paycheck. Teachers are underappreciated and have many struggles. I have best friends who are teachers. I adore teachers, but it is their job. Just like my job is wearing a mask and making sure I'm careful, teachers have the opportunity to do the same in the classroom. If the school is taking all the precautions, just as we are forced to do in every business in America, then what makes the education system so different? I work 60 to 70 hours per week to make sure people are getting tested and getting a vaccine, and I come home to an exceptional young lady that is starting to show signs of despair that I seriously worry she may never bounce back from. Why should teachers be given the opportunity to step back and not get involved in the job they chose? I chose healthcare and all the risks that come with it, even in a pandemic. It's my job, regardless of whether I get to see my parents or run the risk because of health problems. I have a job to do, and I don't get to use an excuse not to do my job. I either show up or find another job. So why is it different for the education system? Virtual learning isn't working. I have an amazing support system and people who do as much as they can for my high schooler, and yet we are still experiencing issues. When I get home from work, I provide social interaction with my daughter so she isn't secluded to our house. We paint, binge watch shows, picnic, pass volleyball, etc., but it isn't enough. And then work after she goes to bed until midnight to stay caught up on my work. It's about sacrifices, but the parents in this group are tired of sacrificing our children and their educations, not to mention their mental health and the overall impact this will have on their generation. Stop the sacrifice and get our children back in school safely, and let those who don't want to work during this pandemic find jobs they can be comfortable with. Millions of people are doing jobs that put them at risk. Some work in grocery stores, some work at hospitals, and some are teachers that I personally know are not afraid to go back with the limitations they know will be in place. I can't attend tonight, but I will be vaccinating and doing my part. I hope others are allowed to do theirs.
Thank you.
Thank you for coming. We're ready for our next public comment, please. Hello, welcome. Please start with your name and where you're from. You'll have 3 minutes, and I'll give you a 1-minute motion. All right?
My name's Elizabeth Cole, and I'm from Arden. Superintendent Baldwin and Buncombe County Board of Education. I'm the parent of a 3rd and a 4th grader at Avery's Creek Elementary. I'm also a Fulbright Scholar in Education and a writing tutor at AB Tech. I want to urge you to reopen schools to face-to-face education with a move to Plan A as soon as possible. It is well documented that students are falling behind, receiving unequal access to education, and being put in unsafe situations. As you know, at least 1% of students are missing, an appalling and inexcusable figure. As many as half of students are failing a class, although the truth is that we are the ones failing students. Perhaps statistics are not enough if you don't have children in the school system and watch them struggle every day. For example, in my daughter's 4th grade class, there are 6 students who consistently finish their work, 1/3 of the class. Of these 6 students, 3 are teachers' kids. Since I work at AB Tech, that means that only 2 students who are not children of educators are even finishing their work. At best, this is discrimination. At worst, we are stratifying our society into those who have access to the educational system and those who do not. The very reason the public school system was created was to ensure fair and equal access to education for all students, regardless of their race, gender, socioeconomic status, or who their parents are. For nearly a year now, we have not provided anything close to a fair and equal education. In fact, it is my understanding that teachers' kids have been allowed to attend school every day during Plan B, while the students who needed the most help have been denied this opportunity. There is no virtual patch that can be placed over this gaping wound. No amount of Zoom meetings, phone calls, or truancy reports will fix this problem. Only a return to in-person education will help the students who have been cheated of an unequal education for the past year. I am also a former foster parent, and I know firsthand the unsafe situations that all too many children live in. Add the stress of job loss and being expected to perform the job of teachers, and you have a recipe for abuse. Our kids deserve better. Our community's kids deserve better. Though I understand that educators desire to be vaccinated, the risk that we as educators face pales in comparison to the risk our children have shouldered for nearly a year. Suicide, domestic violence, child abuse, being left home alone while parents work, internet stalking, these are dangers our children can endure no longer. Please open our schools. Thank you.
Thank you.
Thank you. We're ready for our next public comment. Hello, welcome. Please start with your name and where you're from. You'll have 3 minutes, and I'll give you a 1-minute warning.
Thank you. My name is Jonas Card. I live in Arden, and I have 2 children at Glen Arden Elementary School. I'm here today before the Board of Education for Buncombe County to urge the board to allow full in-person learning to resume at all Buncombe County schools. The stress of working full-time and facilitating full-time education cannot be quantified or put into words. Every student in the United States should have the opportunity to receive a high-quality education during and beyond the pandemic. This is a quote from Executive Order 14000 from the POTUS, Joe Biden. A daily Zoom session with their teacher for 1 hour is not the foundation of a high-quality education. Governor Cooper, State Superintendent Ms. Truitt, and Dr. Cohen of the North Carolina Department of Health and Human Services have stated that they strongly urge that all schools provide in-person learning for students. It's important schools follow the safety protocols laid out by the NCDHHS. This guidance reinforces in-person learning while maintaining strong public health measures. This guidance is the same as it has been for the past year. Wear a mask, social distance at 6 feet, and wash your hands. Students can and must observe these safety protocols in our schools during in-person learning. This Board of Education has had a full year to plan and act in ways to make safe our students, educators, and staff. Despite the need for in-person learning, our students have been remanded to virtual learning since the holiday break. I have asked representation for an explanation of this in-person learning void and been provided a link to a COVID dashboard website. These numbers alone do not represent the full story regarding the need and desire for students to return to the classroom. I sent each member of this board a link to a scientific study conducted which showed that less than 1% of COVID transmissions could be directly connected to in-person learning at school. They found that most transmissions occur in the home. Thank you to the 2 board members who found the time to reply. The CDC states that there has been little evidence that schools have contributed meaningfully to the increased community transmission, keeping infection rates low dependent on students and staff following recommended mitigation measures. The CDC found universal masking, increased physical distance, increasing air ventilation, reduced classroom sizes, and using a hybrid attendance model to limit crowding and reduce number of contacts. With 40% of our student body demanding full virtual learning, this should be possible in our district. Some of our teachers are afraid to return to the job, in many cases, despite the scientific facts which show that COVID is not spread in schools. Science shows, while following the 3 W's, COVID spread is minimal. Let's put aside fear and hysteria and get back to the job of providing the high-quality education our children deserve. Teachers, please stay 6 feet from my 2 children.
Thank you, sir.
Thank you. Thanks for coming. All right, we are ready for our next public comment, please. Welcome. We'd ask that you start with your name and where you're from. And
my name is Andrew Tanner. I'm from the Robertson School District. I just wanted to come and ask that you guys open up the school. I'd like to list some of the stats that I've looked up myself. It looks like North Carolina is 6th in the nation in vaccination administration. COVID deaths in the states of North Carolina is on the 7-day average is rapidly declining. The number of counties that were listed as red or orange has declined 30% in the past 2 weeks. Our 65 and older, they have access to the vaccine. Nursing homes and staff have all had access to the vaccine. We're protecting our most vulnerable population by allowing them to have access to the vaccine. And now I think we need to consider our other vulnerable population, our children. We need to take into consideration the social services and the educational deficiencies that are happening to our children. So please, I'm asking you guys to consider that and open our schools.
Thank you, sir.
Thank you for coming. We are ready for our next public comment, please. Welcome. Please start with your name, where you're from, and you'll have 3 minutes.
Ladinga, I'm from Buncombe County Schools, and I am the president of Buncombe County Association of Educators. And this is a tough place to be in because that was genuinely heart-wrenching to hear every single one of these testimonials. I know there's not a single teacher out there that does not have their heart breaking and want to be in the classroom with these children serving these families. We do want to say, though, that the CDC does not say that it is safe without qualification. Dr. Fauci does not say it's safe without qualification, and even the JAMA report that many are quoting to support how safe schools are qualifies that is very safety by stating clearly that all recommended mitigation measures in schools must continue. Universal mask use, increased physical distance, dedensifying classrooms, using hybrid attendance models when needed, increasing room air ventilation, and expanding screening testing. These were the same recommendations for controlling spread in the surrounding communities to prevent an adverse effect on the school setting. Limiting restaurant and bar capacity, limiting large gatherings, recommending social restrictions, resisting family gatherings and other commingling of people outside of the household. Mandy Cohen stated in the governor's press conference that masks all the time, screening for fevers, wiping high-touch areas regularly are part of the necessary mitigation efforts. We say we want to prioritize returning to normal, getting back into the classroom, but yet our percent positive numbers surge when the temptation was greater than the desire to return to school safely. That doesn't happen when everyone does what it takes to protect one another from the chance of seeing a loved one's life or one's own life devastated or extinguished. We have the power to curb this deadly disease with sometimes difficult choices. Your students have the right to a safe place for learning. Our teachers and staff members have a right to a safe workplace. Getting to that point in this pandemic is going to take some hard choices on the part of everyone. So we advocate not just for reopening, but a safe reopening, one that sets a limit on the percent positive and assures the ability to handle any surges. A return to 100% capacity eliminates the 6-foot social distancing that would make it safe for students and staff. So if it is the will of this community and the school board, we respectfully submit that our staff members who are willing should be vaccinated before we return to 100% capacity. Governor Cooper has the authority to move the essential service back into priority position as vaccines become available. You, as the school board, have the authority to refrain from a move to 100% capacity until such time that that happens. The community has the power to insist on this for both of their children and for the teachers who love and nurture and protect them each and every day. If full vaccination cannot happen due to circumstances within and outside of our control, then nothing more than a hybrid model.
Thank you.
Thank you. Thank you for coming.
Thank you.
All right, we are ready for our next public comment, please. Welcome. Please start with your name and where you're from. You'll have 3 minutes, and I'll motion at 1 minute.
Hi, everyone. My name is Ren Vallely, and I'm a senior at Nesbitt Discovery Academy. I have watched and attended a decent amount of school board meetings throughout the pandemic. It has honestly been infuriating watching decisions be made because of the pandemic without coronavirus, let alone case statistics even being mentioned. As of today, Buncombe County has 13,859 cases and 263 deaths. 100 of those deaths were in the past month. To really put this into perspective, Buncombe County had 159 deaths on December 31st. Also, 14 teachers have died from COVID-19 in North Carolina, and as of February 1st, Buncombe County has a 6.1% positive test rate. Not even to mention that the UK COVID strain has been detected in Charlotte, and the South African variation has been found in South Carolina. The decision to reopen should be made purely based on the state of the pandemic. The fact is, it is not safe to return to school. Cases continue to rise, and bringing people together in buildings, regardless of precautions, is not safe. We are in a public health crisis and need to act as such. Until the pandemic ceases to pose this great of a risk, students and teachers cannot be safely sent to school. This is a pandemic with a deadly virus. People are dying every single day, and I implore the school board to do what is in your power to slow the spread of the pandemic. The only reason to consider sending kids back to school is their mental health and academic ability. Returning under a hybrid plan only makes these problems worse. As a student, I've experienced the decreased academic performance and the mental health effects of online school. The hybrid plan will disrupt the routine me and other students have developed to make do in these trying times. Forcing students to have to rebuild their routines from scratch will not only cause them more stress, but make it harder to learn and complete assignments as well. Under the hybrid plan with people in the classroom and at home, there is a disconnect between students and teacher, as well as separation between students. I've experienced this disrupted connection firsthand, and it only worsens the quality of the education and the camaraderie between classmates. Returning to school will only worsen the existing problems. Thank you.
Pardon me, could I get your name again, please?
Ren Valley.
And where are you from?
I'm a senior at Nesbitt Discovery Academy.
Thank you.
Thank you. We are ready for our next public comment, please. Welcome. We'd ask that you start with your name and where you're from. Both of you, please.
My name is Aria Williams, and I'm here on behalf of the BC Student Coalition. The fact that our movie theaters, restaurants, and bars are open is precisely why it is not safe enough to have our schools open for in-person instruction. A key stipulation in the CDC guidelines that endorse school reopenings is that those very businesses and facilities need to be closed in order for it to be safe enough for in-person education. Our governor has just increased the capacity for restaurants back to 50%, and Buncombe County has not chosen to adopt stricter economic reopening measures. Because of this, we are moving in the opposite direction for reducing COVID-19 spread in our community and our schools. Another important part of those CDC guidelines is the designation of the highest risk of transmission in our schools when the number of new cases per 100,000 people within the last 14 days is greater than 200. Buncombe County has consistently stayed above this threshold. Currently, the county is at 597 new cases per 100,000 in the last 14 days. At the beginning of the school year, it was record-breaking for Buncombe County to have 300 cases in 12 days. The county totaled 12,662 cases on January 24th. Today, 12 days later, we are at 13,859 cases, and we will reach 14,000 within the next few days. While the metrics are comparatively better than a few weeks ago, we are still at the height of this pandemic in our community. It is evident from the dashboard data that the longer our schools are open to operate in person, the more cases we report that are linked to our schools. There are plenty of cases being recorded without the addition of students to our buildings. Our teachers should not be put in this risk, especially when many of them remain ineligible to receive the vaccine. Many of the issues that students and parents have described began before the pandemic. As a student, I can attest that the shift to completing large amounts of assignments online started years ago. We need to address the more fundamental problems with our education system, but until then, we need to stay remote because it is just not safe enough in our community to reopen. Thank you.
Could I get you to, thank you very much. Could you give your graphic to the officer and leave it with us, please? Would that be all right?
Yeah.
Thank you.
Thank you. All right, we are ready for our next public comment. Please start with your name and where you're from.
Hi, my name is Claire Cannon. I'm in 6th grade at Inca Intermediate School. Virtual school, it's really bad. It's hard, it's not simple, and it's just not working. Dr. Dimitri Christakis says increased online use is associated with anxiety, depression, obesity, and aggression, in addition to the medium itself. I spend around 8 hours a day on the screen because of virtual school, and that doesn't count me wanting to watch videos, movies, or playing video games. If I was at school, I wouldn't spend this much time on my screens. I want to go to school, I want to see my friends and my teachers. I need to learn in school when I want to. When I was in school, I felt safe and comfortable with how they were doing things. Thank you.
Thank you.
Thank you. We're ready for our last public comment of the evening. Thank you. Please start with your name, where you're from. You'll have 3 minutes.
Good evening, I'm Jane Cannon. The data indicate that it's safe to reopen schools with specific prevention policies in place. When we were open in the fall, we were strictly following these prevention policies and it worked. I don't need to tell you guys about the evidence that students are suffering with mental health problems. The science is there, it's clear. And I am so grateful that you all promised to follow the science many months ago. The governor says it's time. Our kids are falling behind and we can't wait to open schools. Parents have been here telling you that they want their kids back in the classroom, and we need you to open schools now. The only voice saying that you should wait is the Buncombe County Association of Educators. They're claiming that we should wait until the teachers are vaccinated, but the CDC director, Rochelle Walensky, says vaccination of teachers is not a prerequisite for safe reopening of schools. And the study that you've heard so much about tonight, the lead author of that study says, the worse things get in the community, paradoxically, the greater advantage to be in a high compliance area like a school. So being in a classroom bubble with masks required and distancing enforced and hand washing readily available, it makes for a safe place for our teachers to return. I hope that you will follow the lead of Pat Bryant. We don't need to lock ourselves in with these metrics and the benchmarks. We need to open schools. The study says that it was safe before a vaccine was even approved. So we don't need to wait. We can't wait any longer. I feel like I'm here representing so many teachers who are nervous to stand up and speak out against what seems to feel like Buncombe County's only option is to stay remote. The BCAE does not represent all teachers. And I hope that you guys will actually do a survey of your own and find out what your teachers really do, what they're comfortable with. And while you're at it, ask parents what we need, what we want, ask what it's like in our home, because it's not working for us. It's not working for my family. And I believe that your teachers can turn on a dime and go back to the classroom in person. They don't need 2 weeks. This is what they were built to do. I encourage you to open schools up and open them up now, please. Thank you. Thanks.
Thank you. And this does conclude, Madam Chair, our public comment for this evening.
Thank you, sir. It's time for our superintendent's comments.
February is going to be an extremely busy month of the year for us. It traditionally is a busy month. February is Black History Month, and BCS teachers will integrate age and curriculum appropriate lessons and assignments to explore Black history. While it is an integral part of American history and it's integrated into instruction throughout the year, Black History Month provides an opportunity for teachers and students to delve deeper into the many contributions and challenges for Black Americans. The Buncombe County Schools Curriculum Department has provided resources for teachers and students in order to better understand this important part of the American experience. This week is National School Counseling Week, and the theme is school counselors, all in for all students. And I truly believe that's the perfect descriptor for our BCS counselors and the work they do under the impact of this terrible COVID pandemic. These dedicated individuals have worked tirelessly to provide the social, emotional support that we heard about in our surveys previously today, and create personal connections where our students need during virtual learning. The work of the school counselor has never been more essential as students and families face many challenges of social connectedness and mental health support. And we've certainly heard that the last hour. Through virtual classrooms, social media platforms, phone calls, and home visits, the school counselor has strived to meet the social emotional needs of all students. In addition, high school counselors have a strong focus on college and career goals. You heard Mr. Thompson this afternoon talk about some of those. Suzanne Gavanis and our high school counselors will be hosting a virtual district-wide FAFSA completion night for high school seniors and their parents on February 11th, starting at 6 p.m. And I'm sure Ms. Harris and our communication team will be sending quite a lot of information to our parents about that. We are looking forward to high participation to increase our students' access to federal financial aid as part of the Future Ready NC initiative. And finally, a shout out to David Thompson and his excellent leadership in working with our counseling and student service teams. I told you this was a busy month. Governor Cooper has declared February 8th through the 12th. I think that's next week. I've sort of lost time over the past few hours. But that is School Bus Driver Appreciation Week. Over the past year, our 250 Buncombe County school bus drivers have done so much more than just pick up and drop off students. They're important people. They're important to our organization. And I applaud this board for keeping them whole and keeping them employed even when we're not transporting students. They've delivered technology materials, internet access, provided for students' most basic needs by delivering nutritious meals to families across our county. That has not stopped since March of last year, by the way. Without a doubt, school bus drivers and other transportation staff have had more new things to handle this year than any previous. New tasks, processes, procedures, new rules, cleaning and sanitizing, worries about their own health and safety, as well as the health and safety of our students they transport. I would encourage all of us to take time next week and let our bus drivers know how much we appreciate them as BCS celebrates School Bus Driver Appreciation Week. We talked some today about the importance of extracurricular activities, and I think there's truly a strong connection between that and social emotional health. I recently had the opportunity to observe a remote art lesson at one of our schools in the district, and I could not have been any more impressed with the creativity of the lesson as well as the engagement of the students online. With that said, I want to recognize just a few of the many creative activities of our art educators. Our middle and high school band directors have planned a Buncombe County solo and ensemble music performance for the spring. High school marching bands will soon be active in our stadiums, and many will conduct modified performances on the field. Middle and high school choral directors will be creating a virtual performance of Hagenberg's Songs from Silence. Choral director Dr. Kenny Parter and BCS graduates, these are college students that graduated from Buncombe County. They are at Wingate University, and they will rehearse virtually with a pretty sizable number of our grade 4 through 12 students and present a workshop on voice fundamentals. In partnership with the Leaf Global Arts, that's a local organization of national prestige, several of our art teachers in Buncombe County will be taking active part in a nationally prestigious 2021 Kennedy Center Partners in Education cohort. And Laura Mitchell, who does an outstanding job of directing our arts education across the county, she's working with the Asheville Area's Arts Council and Western Carolina University students on a data visualization project to share BCS course offerings and engagements in the arts K-12. And in closing, I want to once again recognize in front of the public this board's deliberate and consistent process in decision-making when you've considered any change in the plans of how we operate schools. That process continues to include, first and foremost, a careful analysis of COVID-related data and patterns from our local public health officials. And I can't thank Stacy Saunders, our new Director of Public Health here in the county, enough for giving us the access, her and her staff, that she has done throughout. Discussions with public health even extended into the topic of vaccinations for our teachers and staff once Phase 3 opens. Earlier this afternoon, the board heard from a panel representing our school nurses and were made aware of the rapid response COVID testing kits that are now available in each of our schools. In addition, board members received significant information regarding the academic engagement and performance, along with the social emotional health of students that we've been able to collect over the past semester. Many thanks to Ms. Swanger and our district leadership team for preparing that presentation. And to assist your decision regarding the Return to Learn plan on February 15th, the board also received findings from multiple national studies specific to the transmission of COVID-19 infections in schools. And those are fairly recent studies, the releases, by the way. As superintendent, I have firsthand observed how challenging these decisions have been for this board, as you have dedicated considerable effort to balance, and this is a key, to balance the safety and physical health of students and staff with the important goals of providing quality academic instruction and fostering social emotional health. Based on having the opportunity to reflect upon all of the information previously noted, as superintendent, I would recommend that we move toward reopening our schools on February 15th in Plan B for all students who so desire in-person instruction, kindergarten through 12th grade. I primarily base this recommendation on the fact that the local pattern of COVID metrics and data points have significantly trended downward over a 3-week span. Likewise, we have successfully operated previously in a Plan B status for over half of the first semester. In fact, one of the slides that I saw earlier, I think I'm correct with our elementary school students, 60 days in this current year under Plan B. That success was strongly based on protocol and procedures that consistently emphasize following the 3 W's and adhering to the Strong Schools Toolkit developed by our state Department of Health and Human Services and DPI. I believe it is also important to recognize that despite the extraordinary, and I mean extraordinary, dedicated effort of our teachers and support staff to provide all students the best instruction possible remotely, our internal data reflects the need for a return to in-person instruction to keep the balance that I emphasized before for many of our students. That said, there will be no doubt that we will face challenges, especially from a staffing standpoint, for the remainder of this school year, vaccinations or no vaccinations. But providing them to our teachers and staff will play an important part in reducing those challenges. However, we all must recognize that the data clearly shows the vast majority of COVID infections impacting our schools come from outside the school, and they're initiated within the community. All of us can play a significant role in expanding the opportunities for our students to return to the classrooms by at all times observing good habits to prevent COVID. For clarification purposes, Plan B consists of separating students in 2 groups of Monday, Tuesday, and Thursday, Friday attendance in schools with Wednesdays dedicated to asynchronous remote learning, with the exception of, and we received approval from the board, if you recall, at the beginning of this school year, to provide for vulnerable populations in attendance for targeted support and remediation. And we heard a number of comments. One of those vulnerable areas of populations is in our exceptional children. It also falls in some of our Title I. It also includes some of our academically gifted that are taking college courses. So it runs the range of vulnerable populations. Finally, I would promote continued monitoring of COVID data and research, along with guidance from the revisions, and there are revisions in our Strong Schools Toolkit, to determine opportunities to expand in-person learning for students in some grade combination at the kindergarten through 5th grade levels under the allowed Plan A options, which currently exist. To move in that direction, our elementary and intermediate schools will need to address key components of operations, including staffing, facility spacing, and bus transportation. Those requirements haven't gone away. This transition will still require time to plan for accommodating as smooth a transition as possible. So with that, I conclude my comments, Madam Chair.
Thank you, Dr. Baldwin. I start to say thank you, Mr. President. Can you tell what I've been watching? I've just elevated his position here. Okay, the next item is our action agenda, the 2020-2021 Budget Amendment Number 4, Deborah Frisbee. Are there questions from members of the board? Then I would entertain a motion to approve. Thank you, and I think I got a motion and a second in there. And I have to roll call. Pat Bryant? Aye. Amy Churchill? Aye. Amanda Simpkins? Aye. Max Queen?
Aye.
Cindy McMahon?
Aye.
Peggy Buchanan?
Aye.
Ann Franklin? Aye. Next item on the agenda is beginning Teacher Support Program Plan, and that's Ms. Swanger. Are there questions for Ms. Swanger on this item? Hearing none, I would entertain a motion to approve.
So moved.
Thank you. Could I get a second?
Second.
Thank you. Roll call. Pat Bryant?
Aye.
Amy? Oh, any discussion on that? Thank you. Hearing none. Pat just voted. Amy Churchill?
Aye.
Amanda Simpkins?
Aye.
Max Queen?
Aye.
Cindy McMahon?
Aye.
Peggy Buchanan?
Aye.
Ann Franklin? Aye. Next item on the agenda is consideration of Buncombe County Schools Return to Learn plans. And that item is with our superintendent and our board for discussion. So.
Madam Chair, I'm happy to start if that would be helpful.
Do you mind I'm a lip reader.
I said, Madam Chair, I'm happy to start if that would be helpful.
That would be very helpful. Thank you.
I thought it helped us the last time to I don't remember who did it, but we began with a motion that led to discussion, so I want to do that today.
And we have a copy of that, is that correct?
Kim, does everybody have a copy? I have copies if people don't.
I'm going to put it up on the screen.
Okay.
Hang on, just give me 1 second.
As I prepare to read this, I put a couple of words on here for myself that I've tried to use, and a wiser man than I actually use these words tonight, but balance for our students, balance amongst our faculty and staff, balance amongst our families as we try to make decisions on the things that we're going to do moving forward. And I'm reminded of words that my dad had for me years ago. It was long before I ever became a school board member, but he said, you can tell a lot about folks and a group of people, and maybe a larger group of people, by how they treat their elderly and how they treat their kids. and I'm reminded of that this evening. My motion for discussion is I move that beginning February 15th, Buncombe County Schools return to Plan B for all students in K through 13, and it be the intent of the board beginning March 8th for students in grades K through 2 to move into Plan A, and beginning March 15th, students in grade 3 through 5 will also move into Plan A. My rationale for the gap in the dates is that one of the items that I think most of the public has not mentioned, and in fact none of them mentioned it tonight, is that we're obligated to gauge from our constituents who wants to be in Plan C and who wants to be in Plan A and who wants to be in Plan B. And when we make a change, I think it's incumbent upon us as a school system to gauge those numbers, to then gauge staffing numbers. And I direct this specifically to the portion of this motion related to Plan A, so that we do it in a proper manner and we do it well should the board decide that they want to do it. So that's the reason for those dates being where they are in relation to Plan A. I believe firmly, I'm not going to go through and rehash all of there are a lot of studies and a lot of things going on in terms of data. I believe it's the right thing to do. Based upon what we know, I believe it's the right thing to do for us to move our students that we are allowed to move back into the building. I would like to add for the public's consumption, I appreciated the governor's thoughts yesterday, but I wish he had been a bit more clear. He mentioned the toolkit, but what the toolkit says is we don't have the ability as a school board at this time to bring any student back in grades 6 through 13 in Plan A. We cannot do that. Even if we want to do it, we can't do it. The only option we have today, next week, March, whenever, at this point in time is K through 5. And I think the public needs to understand that. We can't do that. So I see the motions on the board. I'll stop talking, Madam Chair. I was just trying to drag it out a little bit so she had it up there and now everybody can see it.
Yes. At this time, is there a second for Mr. Bryant's motion? Hearing none, your motion fails. Anyone else want to speak now?
Madam Chair, I'd like to bring a motion forward.
I'd like for you to remove your mask.
Yes, ma'am.
Thank you.
My motion for return to learn would be beginning on February 15th. All K through 12 will attend in-person instruction on a Plan B schedule, with Wednesdays remaining asynchronous learning days. Yes, I'm sorry, K through 13. I always forget the 13.
Okay.
Thank you.
So it now reads, beginning on February 15th, all K through 13 students will attend in-person instruction on a Plan B schedule, with Wednesdays remaining asynchronous learning days. Is there a second?
Second, Madam Chair.
Thank you. So we can discuss.
I didn't want to be too wordy with my motion, but I do want to make clear that what the superintendent said in his comments, I fully support with offering the options for our vulnerable populations that span the spectrum, as he mentioned and brought forth, as well as look to advancing when it is safe to do so.
Thank you. Are there other comments from other board members? Hearing none, we can vote? No more comments. Okay, at this time we are voting on Ms. Churchill's motion, and I believe Kim's got it up there. Is that correct? All right, Mr. Bryant? We're voting on, oh, you're reading?
I'm aware.
You want me to come back to you?
No. I'm going to vote no on this because we're not considering it all.
Okay. Ms. Churchill,
Plan A.
did I give you enough time to speak, Mr. Bryant?
I'm fine.
Okay. Ms. Churchill?
Aye.
Amanda Simpkins?
I have a question, I'm sorry. So if we vote on this, it's done? Like,
Yes.
this is it?
Yes, ma'am. If this passes, students will begin attending Plan B.
And no further?
With all due respect, someone could make another motion related to K through 5 on Plan A. Someone, if this passes, could still make a motion after this related to Plan A and K through 5 of dates that have already been mentioned, later dates, whatever.
Okay.
Correct.
Okay. Aye.
Aye. Max Queen?
I'm certainly in favor of this motion, but I would want to, I feel like it's lacking in the acknowledgement of the children K through 5 that we feel like that we can get back into school quicker. It's been approved, as my understanding, that we can move forward, providing we have the spacing. But with that said, I'm very much in favor of, at some point, it seems, we've got to set a deadline and say, we have got to start moving stronger toward the A plan, or at least some facsimile of it, getting more of our students back into on an A schedule. But with that said, I will vote in favor of this motion with that caveat, and just for people to think about.
Thank you. That's a yes. Cindy McMahon?
Aye.
Peggy Buchanan?
Aye.
Anne Franklin? Aye. We've got an echo in here. Could technology work on that, please?
There's that echo.
Thank you. It may just be my... All right. So are there other issues or motions or whatever?
I would like to speak and just say a few things and then maybe make a motion to
Thank you.
add on to what has already been said. So, as I listened to the parents that came in, I appreciate everybody that came. I'm also in a situation, I have 2 Buncombe County School students. I have a senior and a kindergartner. And virtual learning it's hard. And I want the parents to know that I get it. It's hard. It's definitely having a negative effect on a lot of kids. I think it's great that there are some kids that are thriving, but I think we have to acknowledge that that's not the norm. Most kids are not thriving in this environment. I realize in a perfect world, our teachers would already be vaccinated right now, and I wish that we could do that before we put them back in the classroom. But the truth is, based on our discussion with public health, we just don't know when that's going to be. We don't know if that's going to be 3 weeks from now, which some people have said in an email, but it needs to be very clear. We have no idea when that's going to be. It could be months from now. And with all that in mind, we have to continue to beg the state to prioritize teachers. So that's what we can do. That's what we can do as a community, as far as our part goes. But right now, we have to also prioritize our kids, and this kind of goes to what Max was saying as well, as far as really trying to push the limit and get kids back in the classroom as much as we can. We need to make sure we're listening to the CDC, our local metrics, as well as our governor's recommendation. And with that, I move that beginning on March 1st, all K through 4 students would move to Plan A 5 days a week, and 5 through 13 would remain on Plan B.
Okay, let's make sure we got that. March 1st. Is it? It's behind me. I don't have eyes in the back of my head. Okay, we have a motion on the floor. Do you have a second?
I'll second that motion, Madam Chair.
All right, Mr. Bryant, it's now time for discussion.
Madam Chair, question for Dr. Baldwin. Well, I think I know where you're going with this, but I'll ask. The reason that you didn't include fifth graders there is for our previous discussions related to busing and transportation?
Yeah, so my reasoning for just going K through 4, and we've gotten a lot of emails on this, but it's my understanding that once sixth graders are put into the mix in any capacity, that the 6-foot distancing has to somehow be maintained, and logistically that's just not possible.
But my question for Dr. Baldwin is, as an earlier discussion, has that, I know it's being discussed to be changed, has that in fact the verbiage changed on that?
We've seen an addition that has been placed in the toolkit. We're making calls. I do not have that answer, 100% accurate answer tonight, but we do feel like that there is flexibility, at least in that toolkit, based upon our interpretation, that would allow the seating for intermediate school buses of 5th and 6th to move to less than a required status, Mr. Bryant. We're still trying to get an official decision on that, so it may take us 24 hours. But there is that potential.
Would your motion change if we knew that?
Yes, so if that is the case, and I noticed that in here, that wording, like it said that if fifth graders were in the building, that the sixth grade, if that's the case, then my motion would have been K through 5.
Right.
And Mr. Shatley, I don't know if there's a way to.
Another motion.
If that's the case.
If the social distancing requirements and transportation would allow fifth graders.
Then it would be K through 5.
To not have the stringent social distancing on the bus when they're riding with sixth graders, then fifth graders be included in Group A as well. But I would suggest it be a subsequent motion.
Got it.
If this motion passes, in order to maybe keep it simpler.
Got it.
I have a clarifying question about this motion. We have talked in the past about those combined 4th grade, 5th grade classes. And in past motions, when this has come up, there's been the understanding that those students who are 5th graders in a combined 4th, 5th grade class could also be 5 days a week. Is
that would be the intent.
Would that be the other thing that I would just like to say is that I also am fully in favor of getting kids back into school at the elementary level, Plan A, as soon as we can. Currently, without a crystal ball, I don't feel like we're there right now with our COVID numbers. I would be more than happy to come in for a special called meeting if our numbers continue to come down, and would happily vote for this. But with where we are right now, I don't feel like I can support setting a date out there in the future when I don't know what the COVID numbers are going to be. So for that reason, I would vote against this motion, but it's not because I don't support elementary school kids in school 5 days a week as soon as we can get them there. I just don't feel like I have enough information at this moment.
Anyone else?
And I'd like to also just, again, remind people that there is a huge difference when you take away one of those W's. And I think of it like a three-legged stool, which somehow a three-legged stool managed to support pretty good. But boy, if you remove one of those legs, you're going to fall on your butt. I'm afraid that might happen if we pull away one of our W's this early. We don't have enough information. And again, we have heard time and time again that if there is not that 6-foot spacing and we have a positive case within our classroom, as soon as that is they are notified of that, the health department, that class or the ones that are in it that cannot say that they were 6 foot would have to go into quarantine, and there was no waiting period. So I personally think that would be a much harder thing for families to try to adjust to at the last minute. So I do not support that, and I would be voting no. Again, I want to see us get into a Plan A as soon as we can, and I'm going to say it again, safely, with those 3 W's or with the vaccine scheduled for our staff.
So you're saying scheduled or that the staff has had the vaccines?
I think at this point, I might start to feel comfortable if I knew that we were getting to the point where we had actual dates on a calendar that our teachers were going to be getting them, and we were in the progress of doing that. And again, this goes back to something that we could discuss at a special called meeting, but when we're talking about March 1st, that's tomorrow. It's not even, it's not even 4 weeks out, so I really struggle with that.
I, too, am very much in favor of getting our children back in school as best we can. And however, this March 1st date does bother me considerably, and for that reason, I would not be supporting it either.
Madam Chair, could I add a thought? And I know I've already spoken once, so if there are others that want to speak, let me just, if
Go
there's
ahead.
others that have, well, there may be others that haven't spoken yet that Ms. Buchanan or Mr. Queen that have something they'd like to add, and I'll wait if they do.
Ms. Buchanan, do you have something you'd like to add?
Well, I want to underscore the fact that I too want to get the kids back to school as soon as possible, but I don't think I can support this motion because of the March 1 day and because of the uncertainty about the grade 5. And what Dr. Baldwin was saying is that we can soon get that answer, but we don't have that answer yet. So there's a couple of things in this motion that, while it supports our aim and what we all want to have happen, it leaves a couple of open ends, so I couldn't support this motion either.
The motion as it is now is K through 4, though, correct?
Correct.
Doesn't include the 5th
Correct.
graders, the current motion.
Right, K through 4, March 1. Mr. Queen, do you have something you'd like to add?
I would like to add something. In regards to the motion, again, it's trying to look forward and set a time where the teachers are on notice, the administration's on notice, parents are on notice, that this is our intent, is to get the K through 4 back on Plan A as of March 1st. Now, according to what I'm looking at on the calendar from today, that's 6 weeks out. And we all know, we were very cautious moving into the beginning of this semester. And by doing so, we opted to, with the surge we expected to see from the holidays, that the prudent thing to do would be to be totally virtual for the first beginning of this semester, with the notion that we would then reassess the values and the data that's there. And that's essentially what we have done tonight and what has occurred over this whole week, looking at the data, looking at statistics. And what we did see from that high, maybe up around 13% back in the beginning of January, that now the county's down to 6.2%. And that's just over a 3-week period. Keeping in mind that at this juncture, nobody has a crystal ball, but of course, we're looking at that and we've got 6 weeks till March 1st. And my point being is, I can support this, but again, I think the reality is that we have to, as we approach that point, everybody's on those. We're going to try to do this, but if something happens that nobody sees coming, just out of left field, and the numbers aren't right, and we can't safely do this, we may have to stay the course with the plan B that we're moving into in this interim period of time. We need to have that leverage. We need to have that leeway and people understanding that. Because again, I'm very much in favor of getting these kids back in school, but we want to do it safely. We want to be safe for both the students as well as the teachers and all of our staff involved.
Mm-hmm. Mr. Queen, you've been in the hospital, and I just want to tell you that March the 1st is
3 weeks from Monday.
3 weeks from Monday. You've lost some time.
I apologize. I'm sorry.
That's all right. Understandably so. So, are there other comments from other board members? Thank you, Mr. Bryant, for calling that to my attention.
Can I just make a comment back to Mr. Bryant's earlier motion that initiated a date of March the 8th. Just keep in mind from the calendar standpoint that this board does have a March 4th board meeting. So that does give, I mean, we've been cautious in terms of making a decision and transitioning in a short period of time from a standpoint of, especially with our parents. But again, trying to project the intent of the board that particular date, if this is the direction the board wants to go, it does give that previous week for the board meeting to take place. I just think that there's some value in that versus the March 1st.
And that was part of the reason for that date for me, but I didn't get to share that because we didn't get a second. To where we are now, I think we have a lot of data that we're not even talking about. I think we have data that we can look at in states around us and around the country. Forget the older population, just in the younger population of schools that have been open for a long time, with children, with masks, but with the younger population in the schools. We have some recent anecdotal data of school systems in the state of North Carolina around us that have brought their younger students back, and they've been able to do it even with the potential for contact tracing to perhaps shut down a room. We have that going on right now anyway with all of our students in our schools. We've said from the beginning, the superintendent may have to adjust the 6th grade wing at Irwin Middle School because of some clusters and do some things differently there than we do in the rest of the system. I think we make a mistake, and I want our teachers to be vaccinated tomorrow, but I think we have to be clear and understand that I don't think we can factor that into this at all. And the reason is we have 35,000 people in Buncombe County right now, 65 and older, based on the data from this week, they're on a waiting list to be vaccinated, and they're getting less than 2,000 doses per week. And they know that's the case for the next 3 weeks because they have their numbers for 3 weeks. I don't see how anyone is going to change that dynamic until we get to a natural progression of doses in arms for the people that have already been scheduled and move into that phase 3. So you're now pushing educators and everybody else in that group well on out into the spring, and you're not vaccinated until 5 or 6 weeks after the first dose, because you got to wait 3 or 4 weeks for the second dose, and then 2 weeks after that before the medical science says that you're vaccinated. So for me, part of the reason, the dates that I chose, I can support March 1st. I was building in the March 4th board meeting, also the ability for our school system to gather the numbers and plan accordingly. And I thought we were going to know in the next day or two. I thought we might know tonight on the 5th graders. But I think leaving here tonight with some plan for Plan A for our K through 4 or K through 5 it's incumbent on this board to do that. And I would have preferred the dates that I had, but I'll support this motion. It would be voting for this motion. And if Ms. Simpkins doesn't make the additional motion for fifth graders, should it pass, I would offer that as an additional motion based upon transportation knowledge that would come down the line.
Sure. Other comments from the board? All right, then we'll vote on the motion, on the Simpkins motion. Can you put it up there again, Kim? Is that too much trouble? Thank you. As it appears on the screen. Mr. Bryant?
Aye.
Amy Churchill?
No.
Amanda Simpkins?
Aye.
Max Queen?
Aye.
Cindy McMahon?
Nay.
Peggy Buchanan?
No.
Ann Franklin? No. All right. Now what do we do?
I don't know if there's any other motions.
Sorry?
I don't know if there's any other motions.
There's not another motion on the floor.
I would like to make a motion regarding our return to learn plans.
Okay.
I would like to make a motion that's rather lengthy. I think our attorney might have the ability to send it to Kim and have it put up.
Kim's got it.
Perfect. Thank you, Kim. Given what we had discussed at our work session about offering some glimpse in a playbook to the community to help follow along with how we come about making our decisions. And again, I want to stress that these are benchmarks and guidelines only. This is not written in stone. But I do believe that this is something that the community would like. It helps to answer some of the whys with our decisions, as well as helps to put in writing something that communities members can help look at to determine what it is, again, that they can do to help slow the spread, keep our numbers in a favorable range so that we can remain in in-person instruction and that we can safely move into a Plan A for all of our kids. I will be the first one to advocate at the state level to move every single one of our children into a Plan A K through 13 when we can safely do that, and I see that we have the community backing and support. So with that being said, my motion would be, are you ready, Kim?
Well, I have a big, long one. I don't.
Right. And so I'll just kind of read off. We made some changes, but I think it is pretty big. That is it. It is the Board of Education's desire to prioritize weekly patterns and trends using the following points of local data to determine the plan of operation for schools. A being diagnostic test positivity rate, B being new positive cases per 100,000 population, C percent change in new positive cases per 100,000 population, D number of school clusters, and E North Carolina alert system color based on combined metrics. And I'd like to draw your attention down to what those metrics would look like. And again, these are benchmarks only. In the highlighted part where it says optional, we would say, as benchmarks only and subject to consideration of all relevant factors, the board will meet in a special called meeting to consider a change in plans if any of the following metrics are met following a 14-day pattern of improvement or increased risk. That being Plan A, positivity rate of 5% or lower, and yellow. So orange has been struck out on the county alert system map. Plan B, positivity rate of 7.9% or lower, and orange or yellow on the county alert system map. And Plan C, positivity rate 8% or higher, with and being struck out and replaced with or, red on the North Carolina County Alert System map. In addition to that, in order to help educators and parents plan for changes in school operations, the above referenced metrics will be utilized to determine an overall pattern of risk level based on increments of not less than 2 weeks. Therefore, before the board would consider a change in plans A, B, or C, the data should demonstrate a sustained pattern of improvement or increased risk over the course of 14 or more calendar days. And I apologize, I had just read that before. I jumped ahead. If the board determines to change its current plan, the superintendent shall recommend a transition timeline for the board's consideration. The superintendent's transition timeline will take into account the orderly and effective operation of the school system, as well as the impact of the transition on parents and students. Furthermore, the board hereby continues to allow district administration the flexibility on a day-to-day basis to move individual schools and classrooms to remote learning, Plan C, based on the availability of adequate staffing. Wednesdays to remain asynchronous remote learning days for K-13 in Plans B and C. The board hereby delegates to the administration the ability to implement direct services for those that are deemed vulnerable populations as needed in Plans B and C. And finally, any decision by the board is subject to any action taken by the governor, the Department of Public Instruction, the Department of Health and Human Services, and the North Carolina General Assembly. And Madam Chair, it would be my desire that this would be located somewhere on our website that parents could go to as a reference.
Do you have a second?
Second.
Who did that?
Cindy.
Okay, Cindy. All right, so we have a motion and a second. Is there discussion?
I do have a question, because I felt like in the earlier motion, you know, what I heard was that you weren't on board with going to Plan A at all unless you know what's happening with vaccinations. So what I'm asking you is, if 2 weeks from now we are yellow and we are at a 5% rate, are you willing to support moving us to Plan A?
I'd be willing to have the discussion. Again, I think we'd have to see kind of where we were at. These are, again, just guidelines and benchmarks and not written in stone. But yes, if, say, 2 to 3 weeks down the road, we have been well under 5%, and we've been hearing from our state that, you know, Plan 3 is in place, and our teachers get to move up to the front of the line, and that I would strongly consider that, yes. But again, these are just guidelines to get us into a meeting to have a discussion, but again, it allows the community the opportunity to follow along with what we are doing and not appear to be just so arbitrary in our decision-making.
No, I understand that. I just think if we get to these levels and we're not prepared to follow through, then what's the point of putting these metrics in place in the first place?
Because it gets us to a meeting to where we can have the discussion on whether or not we should move back into it.
Well, we can do that anyway. At any point in time that 2 members of this board reach out to the chair to call a special meeting based upon change in information. And I have a question for Mr. Shatley. Mr. Shatley, there's, as a point of order and clarity, I don't have it all in front of me, but 50% of this motion seem to me to be things that are already in place and already available at the superintendent's discretion to do, et cetera. Do we need, I've never seen a motion of this length and so much, and the initial comment was, this is not set in stone. I'm not gonna support it, this or any motion that we start out by saying it's not set in stone, and we may or may not follow it
It just seems counterintuitive to me for this or any governmental body to put a motion in place and pass it that would do that.
Mr. Bryan, I do believe it's an appropriate resolution for the board to consider from a procedural standpoint. Obviously, it's up to the board substantively to determine whether to adopt it. I don't want to put words in Ms. Churchill's mouth. I think she was talking specifically about the benchmarks not being set in stone. The one thing that is determinative here is that the board will come together if there is a 14-day pattern of improvement or increased risk within those particular benchmarks to consider whether or not schools should move. So that is enough, I think, for official action. I think a lot of the remainder of this is potentially a directive to the superintendent, as well as to the rest of the board of what you will consider. That's in the first paragraph, that the kind of data metrics that you will consider when making your decisions. So I do believe it's an appropriate resolution for consideration.
Thank you.
And I'd also like to say that, I don't know if you've been reading your email, but I am hearing loud and clear from our staff members overwhelmingly that they want this. They want something so that they are not wringing their hands in anxiety and stress a week before the board meeting, wondering what it is that we're going to do, because they're not following along, and they're not sitting in on our discussions with the health department, and they aren't always sitting in at our work sessions, and same with parents. And again, I just go back to, I feel very strongly that if you put something in writing that parents can go back and look at, then maybe we will make decisions to put our children's education first over trips to Disney, family birthday, parties that turn into, positive cases that send their grandparents to the hospital. Just good choices. And, I don't know, maybe that's just me a year after all of this, just kind of being done with how people seem to want their cake and eat it too. And this just lays it out there for people that, hey, this is what we're looking at. And for me personally, no amount of public comment is going to change my mind to do what I know is based off of safety. Because unfortunately, the decisions that were made for Thanksgiving and Christmas led us to Plan C in the first place. It was never my intention for us to have to start the new semester in Plan C. And quite honestly, it really angered me. It angered me that this community did not value the education of this county. And they made the decisions that they made, and it is very clear. And it may not have been spread in school, but I'm sorry, but when we start seeing metrics that show that we go from, 5% up to 12% in a 2 to 3 week period, and our hospitals were at near capacity, that's a problem. So we have got to do something, and this is where I'm at right now, because I want the kids to be in a Plan A. I want every single child to be in that classroom. I want them to have normalcy. But we have to do that together. And if this will even help a few families recognize how that works and how it is all tied together, then I call that a win.
I like the metrics. My concern is what I felt like was being spoken earlier is ultimately we're not willing to consider Plan A at all until we know for sure when teachers are going to be vaccinated. And the math right now, 35,000 divided by 1,200, how many weeks does that give us? I mean, there's just no way.
Right,
That's months.
Right. Well, I'll be real honest with you. For me, it's going to come down to what I am seeing out in the community, and if I think that we can safely support educating our students full-time in a classroom and pulling away that spacing issue. If I think that I can go to bed at night feeling good about the decision,
But then it's not the metrics at all.
No, it actually is still. But what I'm saying is that you're asking me to say, you know, will I commit to saying I will let kids go into a Plan A without vaccinations? I don't know. That's why I'm saying this would allow us to have a 2-week trend in a special called meeting to further discuss that. Because we need to look at all of the other things like the new positive cases, the % change in new positive cases, the number of school clusters. I certainly don't want to be talking about going into a Plan A if we've got, 10 of our 41, or how many schools do we have? 43 schools have clusters. I think that would be very foolish. So, these are, again, just things that are just, this will be located on a tab where parents and community members can go and just look at it and understand where we're coming from. And if they are data nerds and want to follow along with it, that's great. But it, again, puts some transparency out there, and I hope a little bit of accountability.
Okay, Cindy?
I have a little bit of a different perspective on this. I see it, I think of it a little bit like watching the weather report, watching the weather forecast, that everything feels so out of our control right now with the pandemic. And with this, it gives our teachers, our families, a little bit more information of a little bit more of a look into what is inside our heads as we're considering this and what we are shooting for. So for me personally, while I agree that I want teachers to be prioritized the minute we can for vaccinations, and I'm going to do everything I can and have been and will continue to advocate for teachers to be vaccinated, if we are at the level of 5% or lower in our positivity rates, if we are yellow, if we are wearing masks and washing our hands, and then I actually might be ready at that point to sacrifice going from 6 feet to 4 feet or to even to 3 feet if we're at that point. Even if we're not to the point yet of vaccinating teachers, if our levels are that low, what I'm seeing in terms of the CDC recommendations and other places, I'm going to have more of a comfort level at that point of, yes, potentially sacrificing one of those 3 W's to get the elementary school kids back in school, even if I don't know the date when the teachers are going to be vaccinated. I'm going to be fighting for that, but even if I don't know yet, if we're at those low levels and we know that schools are some of the safest place for kids to be, then at that point, it's going to feel right to me. And so having this trigger for us to come back and having more information for the community to know what we're basing our decisions on seems very positive. And so that's why I support this direction. And also have heard this from, we hear when folks come for public comment, it all feels so divided and so intensely divided. People just on opposite sides of this issue when they may agree on everything else. But folks on all sides, I have heard, please tell us what metrics you're basing your decisions on. And so sharing that information and being a little bit more transparent seems very positive to me. I don't see a downside to that.
No, I appreciate that, and I appreciate knowing that you're open to it in that situation.
Other comments by other board members?
I would just, to answer Ms. Churchill's, I thought was initially directed at me, or towards, not at me, I don't mean that in a bad way, in reference to what you're reading in emails from staff. I read every email, but I don't just read them from staff. I read them from parents, from business leaders, from a lot of different people. The rest of the world, with masks and distancing as much as possible, is going about life. And our 3rd graders, for example,
get one chance to be a third grader. But when I read those emails from staff, I get a lot of emails from those same people. And I would guess, if I went back and counted, and I'm going to do it tonight, I would guess that I've got somewhere between 100 to 150 max, but probably closer to 125 people on staff that have emailed me over the last many months. Get many emails from the same staff. A week later, after the next board meeting, et cetera. Hearing from a lot of the same people. We have close to 3,700, I think, employees in this school system.
4,000, over 4,000.
Yeah.
Total staff.
So there's a lot of folks out there. So if I'm to infer that that's what that group wants, am I then to also infer that the group that's not contacting me wants to be back to work and wants our kids back in school? We have the data. We have the data we need to move forward now. It's not been the pleasure of this board tonight to do that. I'm not going to support this motion for a number of reasons, but I do read the emails. I read every single one of them. I've read them at difficult times, and I continue to do that and will continue to do that.
Well, it wasn't my intention to put that to you. I'm just saying that I've read. I don't know what your emails are saying, if they're saying the same thing as mine, and it's not just staff that have been asking for some type of transparency in our decision-making and where are we getting our decisions and what data are we using. That is pretty much the common thread for all emails that I'm getting. Parents, staff, haven't really heard much from any business members except for the ones that are parents. But, I will say too, though, I have not heard one staff member say they do not want kids back in the building. I have not heard one. Now, maybe they're out there. I'm sure there are staff members who, would prefer to work from home and never step foot into the building again. I have not heard that. What I have heard is that they want to have their kids back in the classroom. They are just asking for us to have some consideration to make sure that we are providing them with safety protocols in place, and that is what I am trying to do. It's why I feel so strongly about the 3 W's. It's why I get angry when I see sporting event photos where people are not following those protocols, and I appreciate our athletic directors, pushing and reminding people that has to be followed, but it's because if we start pulling away little pieces of our safety, we're not going to be safe anymore. And that's just where I'm at personally. It's why I feel passionate about it. I know this is a very lengthy. I will point out that my very original plan motion wasn't lengthy at all at a couple of work sessions, but then I was told that there wasn't enough in it and you needed more information and you wanted more written down. Okay. And so then I handed it to the lawyer and here we are. Sorry to
All right, Ms. Buchanan, do you have a comment that you'd like to make on this motion?
No.
Mr. Queen?
No.
All right, then other board members in here. All right, then I'm going to ask that we vote. And you have a copy of the motion. Mr. Bryant?
No.
Amy Churchill?
Yes.
Amanda Simpkins?
Yes.
Max Queen?
Yes.
Cindy McMahon?
Aye.
Peggy Buchanan?
Yes.
Ann Franklin? No. Motion carries. Are there other items of consideration in this Return to Learn section?
Madam Chair, if I may make one statement.
Yes.
That I haven't heard tonight, and I just want to clarify for anybody that's listening at home or watching, in regards to Ms. Churchill's motion, first motion that was adopted that states beginning on February 15th, all K-12 will attend in-person instruction on Plan B schedule with Wednesdays remaining asynchronous. This would not apply to students whose parents have chosen remote-only learning. Okay, I just want to make that clear because I can see the Facebook, social media comments.
That's a very good point.
Does this apply to me? So this does not apply if you have chosen remote learning only for your child. This would not apply to you.
Thank you for clarifying that.
Yes.
And our motion was for K-13.
Thank you, sorry.
I always forget that too.
All right, it's now time to move to the consent agenda. On the consent agenda are the minutes from January 14th regular meeting and the personnel report. I need a motion to approve.
So moved.
Could I get a second?
Second.
Thank you. All those in favor, do I have to roll call? Oh, my God. Pat Bryant,
Aye.
Amy Churchill,
Aye.
Amanda Simpkins,
Aye.
Max Queen,
Aye.
Cindy McMahon,
Aye.
Peggy Buchanan,
Aye.
Ann Franklin, aye. On your agenda, you have the finance report, and our next board meeting will be March the 4th. The work session updates and closed session will begin at 4 in the Bowcatcher room. Open sessions will begin at 5:30. I need a motion to adjourn.
So moved, Madam Chair.
Thank you. Second? Second? And all those in favor?
Aye.
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 Have to roll call. Thank you very much. It's been an interesting evening, and I sure do appreciate the dedication that this board presents in these issues.